Welcome to Launching Your Professional Career, My Medical Career, and Getting Started. The necessary career documents to launch your professional career are the cover letter, the resume, reference sheet, and your official documents, including transcripts, credentials, and licensure. What is a cover letter? A cover letter is a business letter that aligns your experience documented on the resume with the required skills listed in the job listing. It's important to use key words from the job listing in your cover letter. Keywords, some examples: office medical assistant in Center Clinic, Salem, Oregon. The job description: work with team of 5 physician office, manage care, assist with procedures, work in flu prevention clinic, administer shots, review lab reports, coordinate meetings with drug representative, perform venipuncture, EKG, take and assess vital signs, must be organized and proficient in Microsoft Office Suite, and be able to navigate through electronic medical records. Job type: full-time. Let's investigate what the key words are. Now, highlighted in red, we see job description. Words like team, manage, procedures, skills like administer shots, review lab reports, coordinate meetings, professional performance skills like venipuncture, EKG, vital signs, qualities like being organized and proficient in computer software. Why is the cover letter important? The cover letter's main objective is to secure an interview with a prospective employer. Consider your cover letter a personal message that offers an explanation why your experience listed on your resume meets the skills the employer is looking for. A cover letter, some necessary components. It represents you to the potential employer. It demonstrates your authentic interest. It stimulates interest in your skill set. It matches your skills with the employer's need. When starting a cover letter or resume, you should create a masthead. Here's an example. Creating a masthead, be aware of the font, the color, and the size. Use your formal name, no nicknames. Use a professional email, not a friendly email. Understand the context and format of writing a professional letter. Creating a letter. The introduction. Dear Ms. Moss, it is with great enthusiasm that I apply for the position of clinical medical assistant listed on your company website. I have attached my resume, and it will offer evidence that I am a perfect match to join your team at Cranberry Clinics. The evidence. After introducing yourself, now you're going to supply the potential employer with the evidence that you have the necessary skills and requirements listed in the job listing. You would say, I'm a certified medical assistant with over 1 year experience in a clinical setting. I also have 10 years experience in the customer service industry, problem solving, and working in a results-oriented environment. These skills are the combination that will add to your strong team at Cranberry Clinics. And now you can perfectly match the skills that they list with the skills that you have. Many times it's acceptable and even encouraged to list them in a very clearly and organized bullet form fashion. For instance, she has additional clinical experience includes bullet point, venipuncture, medication and vaccine administration, bullet point, EKG, bullet point, sterilization and procedure assistance, Bullet point, electronic health records, and medical billing and coding. Now you're closing. I am proficient with Microsoft Office Suite, organized, and a team player. I look forward to discussing how I may add value to your team and share my passion for helping people with you in a personal interview. Thank you for your time. Sincerely, Maria Porter, Certified Medical Assistant. Now we can see in a larger format how the cover letter of Maria Porter matches with the job interview. We can see the highlighted red words that are reiterated from the job listing. Career documents. We've covered the cover letter. Now let's move on to the resume. What is a resume? A resume is an organized summary of your experience, education, and skills. You should consider your resume a detailed business card. The main role of the resume is to provide contact information and outline the evidence of your various abilities and accomplishments. What is a chronological resume? It's the most commonly used resume format among career candidates. It lists the career's work and experience in reverse chronological order, meaning with the most recent working backwards. It's an acceptable format for entry-level and even executive positions. It's a favorite of human resource professionals because it's so organized, and it outlines a logical professional progression. What's a functional resume? Well, in this category, it's the format option for those who may have had long gaps in employment or have crossed many unrelated job sectors. It allows the candidate to group skills and experience in a non-sequential order. This would be recommended for parents who may take off time to raise their children and be on board with perhaps even a sick family member, or someone who takes off time that travels and is writing a book or has an extended educational tour. This qualifies for any professional summary. It also has a skill set overview. So it may list, if you're applying for a job in the medical sector, you may pull in your educational sector experience and make that applicable to the job that's being offered. Your applied experience and explain some gaps in your employment. What's a combination resume? Probably the best of both worlds. This format option includes elements from both the chronological and the functional format. It can add to the young entry-level candidate or consolidate experience for the older or more seasoned candidate. It's a comfortable fit for someone with a longer career. It shows relevance of training skills. It creates a logical connection of a varied skill set. The resume. Important components. It provides contact information. Remember, the cover letter's main job was to secure interest and create an appointment for an interview. The resume is going to provide that evidence that you qualify for that interview and provide all of the necessary contact information. It documents your education. It organizes your employment. And it highlights your skills, awards, and organizations, things that may be unique to you that have you stand out from some of the other candidates. The resume components: contact information, your education, your work history, some highlighted additional components that may not be necessary but are always welcome, your skills, your job objective, your awards and organizations. This is an example of Maria Porter's resume. This again is her masthead. Use your created masthead that you did for your cover letter and continue it through all of your written communication with your potential employer, including follow-up letters. Use your formal name and add your credential. A street address is optional. You may use a professional email. List your education with a degree. Only include a GPA if it is 3.5 or greater. You can also use awards like Dean's List or Summa Cum Laude, organizations that you may have academically merited. When writing your education, list last, first, or the most recent. It's unnecessary to list a high school education. Identify the school and the city. List the year, the major, and GPA if it is 3.5 or greater. Question: do I only list jobs in the field? Well, not necessarily. Not all employment will fall under the sector you are seeking. So it's important to tailor the experiences you have with the duties required in the application. So if you have experienced several part-time jobs or seasonal work, it may not be necessary to list them unless it excuses employment gaps or some of the qualities like using different or various electronic equipment or customer service skills or telephonic coaching, etc., would add to the experience of your resume. Your work history. Most recent first. Offer related job descriptions. List the past 10 years and plus relevant education and work history. Don't clutter with unrelated. So your work history, for example, this is how our medical assistant has listed hers. Her work experience: she worked at the best clinic ever on Main Street in Perfect City, Pennsylvania. It was her clinical externship. She lists the dates where she was there, May of 2016 to July of 2016. She worked 240 hours in a fast-paced, large 12-physician hematology office. She greeted clients, scheduled appointments, and billed for services. She performed venipunctures, vital signs, and assisted with examination procedures. So many of the skills that she demonstrated at this particular externship/job have given her experience to qualify for the job listing. This is an interesting job she had for 8 years, from 8/08 until 5/16. She was a customer care supervisor. She was a telephonic healthcare customer service representative. She handled greater than 60 calls per shift concerning coverage questions. She was promoted to shift supervisor in 2012, and she managed a call staff of 10. So although working in a telephonic coaching situation may not directly relate to becoming a medical assistant, in this case, because she dealt with healthcare, she was promoted and she was a manager. All of these skills, leadership, team, organization, and critical thinking skills will definitely apply to the position of office medical assistant. How long should your resume be? Well, here's some data that might help you decide. Research shows that the average employer scans in less than 10 seconds, so organized resumes are offered a more detailed look. Resumes should be limited to one page, clear, with a clear meaning and easy to read. Resume facts. Each employer or HR professional will give it a 6 to 10 second glance. It must be visually organized. White space and top half emphasis. Remember, the eye is going to be directed to the top of the page, so make it inviting and organized. Match your skills and mirror keywords. What is a job objective? Well, here's an example of a job objective. Obtain a position in the medical field that utilizes my solid clinical skills, strong organizational and interpersonal skills, and allows me to pursue my passion for helping people. Additional information. Certifications. Here's some examples of certifications. For instance, certified medical assistants, and then you would list the governing body that gave you that sanction or certification. Certified CPR, then again you would list the governing body that you obtained that certification with. You would also list the dates of that certification because many of the medical certifications expire. So it's important to list the date. Emergency first aid, for example. Your skills. Now you want a skill is something that's a verifiable task that you can perform. So being proficient in Microsoft Office, quality schedule. Quality is the name brand of a scheduling app. Quality schedule certified, and billing and coding, in electronic medical records. So these are all important skills. Something like team player, great listening skills, solid communicator. They are qualities. They're not particularly skills because it's difficult to measure them. So now that we've covered the cover letter and we've covered the resume, let's move on to the references. What are references? Well, references should never be included automatically with the resume. They must be furnished upon request. Some employers will say, forward your cover letter and resume and 3 references. If they ask for them, you can list them independently, not on the resume. It must be separate from the resume. Verify the resume information. That is the whole idea. If you have a communication breakdown with your current manager, even though he or she is your manager, you would not ask them to be to give you a reference because perhaps they're not seeing your best qualities. You want someone that's going to offer solid character testimony. Always ask someone before listing them as your reference. They should be a former supervisor, perhaps a peer that took the lead with a project that can demonstrate how you are, to work in a professional environment, or even a teacher. Never a relative. References, for example, Mrs. Medical Smith, RN, Director of Nursing, Main Street Hospital, Perfect City, lists her phone number and her email so that she can be verified. Mrs. Anatomy Physiology, she is an assistant professor. So again, perhaps this was a former teacher. And perhaps this is someone that was the overseer of her externship. She's the practice manager of a physician's office. So these are excellent references. But again, most important, ask the person that you're going to list as a reference permission before you list their name. We've covered the cover letter, we've covered the resume, we've finished our references. Now let's tackle the official document. Transcript facts. A transcript is a permanent academic record. It must be sealed. You cannot make a photocopy and bring it or drop it off in the HR office of your new employer. If a transcript is requested, you must go through official channels so that you have a sealed original copy. It must be sent directly to the employer. I always recommend that you order a copy for your professional and personal records. What is a license? A document verifying competency in a particular skill. It's issued by the state or national bureau or a professional organization. You must list the agency, the state, and the year. Examples: CMA, Certified Medical Assistant; LPN, LVN, Licensed Practical Nurse; CNN, Certified Nursing Assistant. We've covered the cover letter, we've covered the resume, we've covered our references, and we've tackled the official documents of transcripts, credentials, and license. Don't forget some components to remember. The cover letter. It represents you to the potential employer. It demonstrates your authentic interest. It stimulates curiosity and interest of your skill set to your new potential employer. It matches your skills with the employer's need. Your resume. It provides contact information. It documents your education. It organizes your employment. It highlights skills, awards, and organizations. Your references. Never automatically include a reference. Only send upon request. Always ask in advance and select wisely. Your official documents. They're transcripts, credentials, and license. Your career documents for your medical career. Your career documents. You should be an expert. Thank you so much for your attention, and best of luck in launching your professional career.